and I welcome you to this Lunch and Learn entitled Just the Facts, COVID-19 and Maternal and Infant Health. It is our pleasure to sponsor this program today because it's been on our minds for quite some time. With the advancement of the pandemic and with the unfortunate misinformation that is often shared about the vaccination process, we felt that it was important to work with, provide information to, and have a conversation with practitioners and social and human service professionals as we attempt to raise the percentage of those who choose to be vaccinated during this pandemic. We also know that because there are additional concerns for pregnant and parenting moms, that there was an important aspect of the conversation that often, again, has misinformation. And so after conversations with CareSource and conversations with our our Franklin County officials, we decided to put this Lunch and Learn on as an opportunity to not only educate the public, but more specifically, those of you who are on the phone who are human service providers and practitioners, so that you have an understanding of how to share this information with those who are deciding the vaccination path that they are going to take. And so again, I want to thank you for joining us. We have a fabulous panel today. And at this time, I will introduce them. If you could just go on to the next slide. Dr. Elizabeth Koch has been Outbreak Response Director at the Columbus Public Health Department since 2009. In her current role, she coordinates a multidisciplinary team of public health nurses, disease intervention specialists, epidemiologists, and sanitarians to ensure timely and comprehensive outbreak investigation and response. During the pandemic, Dr. Koch has had active participation in the COVID-19 response as a medical subject matter expert. From 1998 until 2007, she fulfilled the role of infectious disease investigation and outbreak response chief and tuberculosis controller at the Ohio Department of Health. Alexandria, and we know her as Alex Jones, joined Franklin County Public Health in June of 2018 as Assistant Health Commissioner and Director of Prevention and Wellness. Ms. Jones has served in public health nursing leadership positions in both the state and local level. She is the 2017 graduate of the Robert Wood Johnson Foundation Public Health Nurse Leader Fellowship Program. Ms. Jones has a Bachelor's of Science in Nursing and Master's of Science in Nursing with a specialty in Public Health Nursing Administration from Ohio State University. Dr. Kami Dixon-Shambley. Dr. Shambley is an assistant professor of OB-Gyn within the Generalist Division of the Department of Obstetrics and Gynecology at the Ohio State University Wexner Medical Center. She's also Vice Chair of Diversity, Equity, and Inclusion and Medical Director of the Moms to Be program, which is an innovative community-based pregnancy and postpartum education and support program with a focus of decreasing the infant mortality rate in Franklin County and Montgomery counties while eliminating disparities in care. Her career interests are eliminating racial disparities and ethnic disparities in reproductive health care, improving the healthcare access and quality in historically underserved communities, and implicit bias and anti-racism training for faculty, staff, and medical students. Dr. Beejadi Mukunda. Dr. Mukunda is the medical director of MyCare, which is a part of CareSource. Dr. Mukunda is also the president of Atrium Medical Group, director of Department of Medicine, and past chief of staff at the Cleveland Clinic Hillcrest Hospital. He received his medical degree from, I'm going to mess this up, doctor, excuse me, Karnak Medical College in India. Dr. Tosin Goje is a board-certified OB-GYN and infectious disease specialist at the Cleveland Clinic Obstetrician and Gynecology and Women's Health Institute in Cleveland. Dr. Goje leads the gynecologic infection disease team and also completed her internship years in internal medicine at the Metropolitan Hospital of New York. Dr. Goje is Associate Professor of Obstetrics and Gynecology and Reproductive Biology at Cleveland Clinic's Lerner College of Medicine of Case Western University, and has been on the front line of the COVID-19 pandemic, educating, researching, and serving as an advocate. We are very, very pleased to have our panel today and want to thank all of you for your participation. So the format of this day will be, we will have remarks and then just a question and answer to break up the constant talking to or through to you as panelists and as guests. But then we will have an open opportunity to have a dialogue. Because it's important to get your answers to your questions and to get these experts who have joined with us today the opportunity to give you their best insight on what is happening in the maternal hot child space as it relates to COVID. And so I'm going to first call on Dr. Koch to give some opening remarks and presentation, and she will be followed by Miss Alex Jones from Franklin County. And so, Dr. Koch, you can take it away.
Good afternoon. I really appreciate the opportunity to participate this afternoon, not only on behalf of Columbus Public Health, but also as a resident of South Columbus, born and raised, still live there. CelebrateOne is near and dear to my heart. And I look forward not only to the session today, but hopefully opportunities for collaboration in the future. I'm very grateful to Ms. Gretchen James for advancing my slides. Are you able to hear me?
Yes, we are. We're on slide number 2 of your presentation.
Oh, I'm sorry. On my screen, I was not seeing it advanced, so sorry for the technical difficulties. So wanted to share a little bit about COVID-19 prevention. Even though the vaccine is a very powerful tool, we still need to remember to use all of the strategies that we have available to prevent spread of this disease in our community, such as mask wearing, washing our hands, and physical distancing. So the benefits of COVID-19 vaccine include helping prevent us from getting COVID-19. Getting vaccination is a safer way to build immunity as opposed to getting the disease. And this is a very important tool to help bring an end to this pandemic. All 3 of the currently authorized or approved vaccines in the United States are highly effective in prevention of severe illness, hospitalization, and death. There is currently a preference for the mRNA vaccines, Pfizer and Moderna. The next slide is guidance specifically for COVID-19 protection during pregnancy. This is available at the CDC website, and it stresses the importance of vaccination for pregnant people, not only to prevent COVID-19 in themselves, but also in their newborns. Next slide. I did want to touch on COVID-19 vaccine disparities, which at the health department we're very aware of. The reasons for this are many, including, as Director Stapleton mentioned, misinformation, but also mistrust, issues of access, and historical mistreatment of minority communities by the medical community. So we recognize that vaccine hesitancy is real, and not only must we acknowledge it, but we must address it. Next slide. So at Columbus Public Health, we have implemented a vaccine equity priority plan, and this focuses on both informing and engaging vulnerable communities. And you'll see here 4 key ways that we're doing that: by reaching out to community partners and influencers to carry the information to the community, by facilitating conversations about vaccine with minority groups, our partnership with Department of Neighborhoods to engage the community and actually get out into the community to provide solid, reliable information, as well as a community multimedia campaign with special focus on underserved minority communities. Next slide. So availabilities for vaccine at Columbus Public Health are both here at the health department, and this slide shows our current schedule. These are walk-in, no appointment needed clinics Monday through Friday. And then next slide highlights our community vaccine clinics in various areas of the community. These are the current sites, locations, and times. Next slide. And then I know we're limited on time, so starting here, I have a series of slides. We don't have time right now to go through them, but basically it talks about the important role of providers to bridge the gap between the myths that are out there and the facts. So with that, I think I'll conclude opening remarks. There are, I think, 10 additional slides that specifically address myths and facts about COVID-19 vaccine in pregnancy and in general. So I'll stop there and welcome my colleague at Franklin County Public Health, Alex, to talk about initiatives in the county.
Thank you so much, Dr. Koch, and good afternoon, everyone. It's a pleasure to be with you today. So as the director graciously introduced me, I'm Alex Jones, she, her, hers, and I serve as Assistant Health Commissioner at Franklin County Public Health, and I am leading our operation response to COVID-19. So I wanted to spend a little bit of time today providing some data information, and then as later in the conversation that our colleagues will be presenting on around some specifics as it relates to vaccination for pregnant persons. So one issue that we know that we are currently experiencing in our community that Dr. Koch addressed is that we are seeing low vaccination rates among pregnant persons. And this has to do with multifaceted issues. Misinformation is a big one that is out there. Concerns about COVID. Oh, so sorry, my mic is muffled. Hopefully, is that any better? Oh, perfect. I was telling them earlier, I am a GoToMeeting newbie or WebEx newbie, so sorry about that. But like I was saying, the issues is multifaceted, so there's misinformation, there's concern about vaccine safety, and I think as public health practitioners, we need to take some responsibility around some of the confusion as relates to public health messaging. So I wanted to share some high-level data. One of the limitations to our data here is that on the local level, it is difficult for us to have state and county-specific information, so I'm providing some CDC national level data. So you can see here in the United States from December 14th, which is really where the beginning of the vaccination campaign began, to present, only 42% of individuals who are pregnant individuals have been vaccinated against COVID-19, either prior to pregnancy or during pregnancy. And the information can be stratified via race and ethnicity. So our highest amount of vaccination rates are those who identify as Asian, non-Hispanic, and our lowest we are seeing is our Black, non-Hispanic rates here as relates to pregnant persons. So we know, and the clinicians will be speaking to this more in depth, but that COVID-19 is severe and can have long-term consequences for both the pregnant individual and the infant. So we know that there can be severe illness related to contracting COVID during pregnancy, and that your risk is higher for severe illness if you have some other additional underlying conditions. Certainly if you reside in an area where COVID transmission is more prevalent or rampant in your community, as well as for individuals who might work in higher risk occupations where they are not able to be at home and to be kind of shielded to be able to do that physical distancing mitigation strategy. And we know that pregnant people who have COVID-19 have increased risk for preterm birth, stillbirth, and other pregnancy-related complications. So here's just a little bit of data on infection by trimester of infection. You'll see here that the majority of individuals who are testing positive in their third trimester of infection. Here's some data that was collected. This is our cases, number of cases across the United States by week of diagnosis. I do just want to highlight that it's 160,873 women. We do know that there is underreporting due to interviewing, and not everybody is being captured in this data. So just like our testing data, we know that this is more than likely an underrepresentation. Some statistics about those individuals here. You see the number, that 160,000 who are pregnant who have had COVID-19. Unfortunately, that has resulted in 263 deaths, 27,000 plus hospitalizations, and 650 plus ICU visits. And then here we have the age distribution of pregnant individuals. Not surprisingly, those who are in childbearing age, 25 to the 34-year-old age group makes up the most COVID infections. And then here we have by race and ethnicity where the COVID infections are skewing. So white, non-Hispanic, followed by Hispanic or Latino, and then Black non-Hispanics are making up the majority of those infections. So I know we'll be getting to this a little bit more as the presentation continues, but like Dr. Koch was saying, one of the primary approaches is for us to empower pregnant individuals with knowledge, to give them trusted and reliable information, which we're going to be doing here today and with the help of everybody on this call here. So what the end result is, we're supporting a more informed decision-making process for the individual, their family, and their unborn child. So certainly we want to encourage sharing of facts, information. Storytelling is powerful, we know that, and really being available to answer questions and concerns and have that conversation. I know sometimes we hear that my provider made a recommendation but didn't tell me why. So, we're taught to make that strong recommendation, but then to hear that individual out and to provide that additional factual information that they need for that decision. And certainly, as was mentioned, vaccination is a key part of the strategy, but there's other strategies as well. So certainly, we want to keep physical distance. We want to cover our cough, good hygiene, ventilation, staying home when you're sick, and testing are all public health strategies. That I will turn this back over to Director Stapleton. Thank you so much for having me today.
Thank you, Ms. Jones. I really appreciate both of your presentations. I have a couple of specific questions for you. First, in Franklin County, what number of COVID cases are involved that involve pregnant women?
Dr. Koch, I can maybe start and then certainly. So I know one of the limitations that we have with our data is that we don't have a good handle on how many individuals are actually within our jurisdiction that are pregnant. This has to do with interviewing, and right now, as everybody knows, we're in this surge. So we would not know if an individual is pregnant unless there is a physical interview. So I know for us at our in our data, it is difficult to extract that, but I'll turn it over to Dr. Koch and see if she has additional on that.
Dr. Koch?
Yes, I would echo what Alex just said for Columbus. For the vast majority of our cases in childbearing age, the information about pregnancy is missing. Many times it's because we aren't able to reach the individual to do an interview. Sometimes perhaps the question hasn't been asked. Looking at our data from the beginning of the pandemic in Columbus, there have been over 66,000 confirmed and probable cases among females of childbearing age, and only 2%, but again, it could be much larger than this, but in our data, only 2% are known to be pregnant. So I would say this is an area I wish we could focus on more moving forward so that we can identify those who are vulnerable and have better sense of how COVID-19 is affecting pregnant people in our community.
In as much as that our data, it doesn't necessarily catch up or identify pregnancy, and COVID. Based on the current surge and the impact on the possible impact on pregnant women, do pregnant women need to take additional precautions? And if so, what should they do?
Yes, I think that's an excellent question and point. We would absolutely encourage enhanced precautions for pregnant women. Certainly as the surge has been ongoing, and we know that just in general, and it has not to do with a certain population, but there is fatigue. And so we're letting our guards down and really kind of going backwards and not using those strategies that we know help protect individuals. So, really physical distancing, wearing a mask when you are out in public or around others are key strategies. Being vaccinated obviously is what we're talking about here today, but anything that they can do to protect themselves and their families, that's what we would encourage with that. So I don't think it's anything specifically different. It's just having a heightened awareness of making sure we're implementing all the public mitigation strategies.
Dr. Koch, do you have anything to add there?
I would just add and I think it's the goal today to talk about the safety of the vaccine during pregnancy, and that there is a risk in pregnancy from COVID-19, but it is from the illness, not from the vaccination. And a lot of the misinformation that is out there is attributing the vaccination to causing complications of pregnancy, and it's actually the disease that is causing those complications and sometimes the death of the mother and the baby. So, and of course, what Alex said, emphasizing all of those strategies so that we can protect these very vulnerable, precious members of our community.
Thank you, ladies. We will come back to you in the question and answer period at the end. Now let's hear from our community partners at the Ohio State University Wexner Medical Center about moms-to-be. And Dr. Kami, you can take it away.
Hi, good afternoon, everybody. Thank you for hosting this really important event. Thanks for having us. I'm going to talk a little bit briefly, just to give an overview about moms-to-be and the transition that we had to make during the beginning of the pandemic, and how we have had sessions to talk about the importance of the vaccine with our moms. You can go to the next slide. So just as a background, Moms-to-Be was started in 2010 by Dr. Pat Gabby and Twinkle Shockey in Wyland Park to address the exorbitant amounts of infant mortality in that area. You can go to the next slide. Sorry, you can go to the next slide. And as far as the mission, so the mission is to improve the health status of historically disadvantaged communities by empowering pregnant women to deliver full-term healthy babies and to eliminate disparities in infant mortality. Moms-to-Be addresses the social and clinical determinants of health and inspires future healthcare providers to serve with empathy. You can go to the next slide. So I'm going to talk a little bit about what we looked like before COVID. We always joke around about pre-COVID, post-COVID. So this is what we looked like before COVID. We would have 2-hour sessions weekly at 8 different locations. So that original Wyland Park location expanded to 8 sites. And then we also did expand to Dayton as well, and I'll talk a little bit about that in a little bit. But at each session, we would have group education. We would provide a heart-healthy meal. We would have the ability for our moms to interact with our multidisciplinary team, which includes nurses, social workers, dietitians, patient navigators, myself as an OB. So a lot of different community health workers. We have a lot of different components to our team to really address the needs of our moms. You can go to the next slide. And these are just a list of social determinants of infant mortality that we address through our program. So things like poverty, housing insecurity, food insecurity, neighborhood with high crime rate, lack of social support, stress, anxiety, depression, education and employment, transportation, racism, and access to healthcare, and smoking and substance abuse, which we all know influence the outcome of pregnancies and the health of our moms in the program. So we get them connected to resources to address these social determinants of infant mortality. Go to the next slide. And this is just kind of showing where we were, once again, pre-COVID in person. You can go to the next slide. So we had to make a huge transition when the pandemic hit in March 2020, where we had to transition from in-person sessions to virtual sessions to provide protection to our moms in order to enable social distancing and to help stop the spread of COVID-19. And we were able also to expand our program to Dayton virtually, where the number's a little bit different now, but previously we're serving 54 moms and 4 dads. You can go to the next slide. Another important component of our program is actually the Dads-to-Be program, which is a program that serves the dads in the program and helps provide education to them in person and virtually as well. And when I think that's actually one of the more unique things about our program, especially when I'll talk about how we've addressed education about COVID-19, because we have the ability to speak to whole families, which really does have a huge impact as far as this education. You can go to the next slide. So as I said, we did have to transition to virtual. And initially we started by leveraging our social media accounts. So we do have a Facebook account and Instagram. And we did Facebook Lives. We had videos about the importance of, at that time, this was before the vaccine, so washing your hands, social distancing, making sure that you are avoiding crowds, and all those things, are wearing a mask. So we talked about all that pre-vaccine. Of course, we still talk about those measures. But then we also expanded to use Zoom sessions to enable our group education and start to mirror what we had before the pandemic. And since that time, we've actually expanded. So we do have 7 sessions weekly where we have parenting Zooms. We have Zooms more geared towards the parenting aspect. We have Dads to Be, we have Kids Zooms, we have Baby Zoom where we have kinder music. So we've really tried to replicate our program virtually because we know how important it is to get the education to our moms and help them feel connected. We also do case management weekly. So besides our education component, we do reach out to the moms to make sure we do needs assessment and just check in and see how they're doing. You can go to the next slide. So this was just one of our flyers from our Facebook Live that we had. And in this one, we did just open Q&A about COVID. And once I said, this was really towards the beginning of the pandemic and just really outlining what we knew at that time. And also starting to talk about what it would look like birthing during a pandemic. Because I think that was a huge question a lot of our moms had. You know, who would be allowed to come with me in the hospital? What happens if I get COVID? Am I going to be separated from my baby for weeks? You know, things that were really kind of anxieties that we've been hearing in the community that we're able to address. So we did that through a Facebook Live. You can go to the next one. And then, as I said, we have our Zoom education sessions. And at our peak, before we were able to return in person over the summer in 2021, we did have 11 sessions weekly. At this moment, unfortunately, we're back to 100% virtual just because of the Omicron surge. So we are really thankful that we have this in place to be able to reach our moms. You can go to the next slide. Additionally, you know, the question we always get is, well, do our moms have access to internet and to the, you know, the technology they would need to be able to access the Zoom sessions? So we were able to secure funding through the CARES Act to fund an iPad program. So we have Wi-Fi enabled devices where we can give this to our moms so they can be connected to the education, and they can keep this device until they complete the program, which is through the first year of life, until their baby turns 1. You can go to the next one. Additionally, as I said before, in person, we wanted to make sure we connected moms to the things they needed. So things like, you know, food, making sure that they have access to a heart healthy meal, and getting them access also to food pantries and to other baby care needs and other things they may need. So we were able to coordinate with St. Stephen's, and we would have a food pantry. We also worked with Life Care Alliance to deliver meals to families. We just didn't want to have this gap in care during the initial shutdown. Additionally, we did when we went back in person, we were able to leverage the Michelle Obama produce program. So we had big boxes of produce for our moms to take home and use. So it was just a really great way to get them what they needed. You can go to the next slide. Additionally, we do also have a collaboration with Community Care Coach. I get to be on this coach, which is really great. And we come to our North location every other Tuesday. And I got trained to give the COVID vaccine, which was really great because we would have sessions with the moms and talk about the benefits and debunk the myths. And then I could say, okay, who wants to come on the mobile unit with me next week? I'll be giving them to you. And it's from a provider that they know. And one point I meant to make earlier that was actually touched upon by Alexandria, one of the hallmarks of our program is CPR. So we're consistent, we're predictable, and we're reliable. And that is one of the most important things when we're talking about really building trust in the community. And that's one of our hallmarks at MomSpeak. You can go to the next slide. And this is just the end. So if you have questions, of course, you can reach out to us. That's our number there. And then myself and our director, Twinkle, our information. And I'll just pause here for time and let Director Stapleton take over.
Thank you so much, Dr. Cami. We really do value the work of Moms to Be. Can you describe some of your biggest concerns that you've heard from moms and families regarding getting the vaccine? Can you go over that a little bit? And how does your team assist in addressing their concerns?
Absolutely. So as I said, the biggest thing is making sure that we have those conversations with our participants. And I think even, you know, in my practice a lot as well, I see that just that consistency in asking people, have you gotten the vaccine, and not stopping the conversation there, right? So they say no, why? Why not? What have you heard? And I always make it very clear, like, you can tell me whatever you've heard, like, let's talk about it. What have you read online? And a lot of things there, we had a really great Q&A session in the fall where a lot of myths were debunked. Things from, I don't know what's in the vaccine. There are different there are different things in there that I've heard cause cancer. I've heard that this will make it so I can't get pregnant again. I heard that if I got this, it would affect my baby. Additionally, there are concerns that were expressed by some of our participants that a family member had concerns. So they were ready actually to get vaccinated, but maybe their mom didn't want them to get vaccinated or their partner didn't want them to get vaccinated. So one of the other things that we always offer is that if they have a family member who wants to talk to a medical professional, we can get connected to them, and I'm happy to have that conversation. So once again, it's from a source that they know and trust. And that is probably the biggest thing. And I mean, we know that we do have an uphill battle because there is, we know that we have issues with structural racism in this country. And we know that with the historic distrust of the medical system because of the atrocities that happened in the past, we do have a lot of things that we have to fight. But it's important for us to continue this conversation and show that we can build trust.
Thank you. Next question is, how do the social determinants of health, and I think you spoke to this a little bit, but let's talk about how the social determinants of health play a role in the impact of COVID-19 infection rates amongst moderate and low income families.
So yeah, I mean, I think there are many different factors. The first of which, of course, we always have to think about is access, right? Do you have access to a medical professional? One of the bigger pushes that we've done, we did this pre-COVID. One of our focuses actually is that making sure that our moms are connected to a primary care provider. And I think a lot of us knew when COVID first hit, that was the gatekeeper really to get information, to get in, to get whatever you needed to have a PCP. Even at the very beginning to get tests, you needed to have a PCP. So we were thankful in that we had that education online for our moms, but still it's hard for people to get access to care. And that's one of the things that we were really focusing on. Additionally, when you think about same thing with the access, are the clinics during times when people can access them? Do they have transportation to get there? And that's one of the big things that we make sure our moms have transportation to session. And then we do offer them whatever you need to help to get you to a vaccine, we'll get you there. We tell them where they can go. We tell them if you need transportation, let us know, we'll help you coordinate it. We want to make sure we can remove those barriers so they can get the vaccines and then are able to live a protected life with their families.
Yep. Thank you very much. Thank you very much. And again, we'll come back at the end for a more robust Q&A from our audience. We have two physicians who can share the facts around the effectiveness of COVID-19 vaccines for moms who are pregnant or nursing. We will first hear from Dr. Beejadi Mukunda, and then that will be followed by a brief presentation by Dr. Tosin Goje. Dr. Mukunda?
Good afternoon. Thank you, Director Stapleton, for giving me this opportunity. Are you able to hear me okay? Great, thank you. So I serve as the Medical Director for MyCare in CareSource. I've been assisting our Chief Medical Officer and the Quality Department. We are all working together with other plans that are Medicaid managed plans in Ohio, along with the Ohio Department of Medicaid, Dr. Mary Applegate, Director Corcoran, closely working with the ODH and the Governor's Office to really improve the vaccination rate among the Medicaid and MyCare recipients. We initially started helping many of the long-term care facilities when the pandemic broke out. And there we saw that when the vaccinations became available for healthcare workers, there was very little uptake among the healthcare workers that were women in the childbearing age. And that's when we realized that there is going to be, concerns in the community because many of the providers, if they are not taking the vaccination, if they are hesitant, it will be difficult to convey the trust to the community members. So our work started there, and we are continuing to work in multiple groups involving all the Medicaid managed plans, along with our great partners in the healthcare, including Ohio State, Cleveland Clinic, UH, Metro, to address this vaccine hesitancy. Next slide, please. So what we found most appealing and most effective in terms of addressing the vaccination, as Dr. Dixon mentioned, is really motivational interviewing. Listening to the members, listening to their concerns, and addressing those hesitancy or the myths that have been propagated along with their partners, their family, so that we are able to really get to the bottom of the mistrust or the myth, so that we are on the same page and there is buy-in in terms of vaccination. Next one, please. And initially, the pregnant women were not included in many of the trials, and so there was not a whole lot of data, but now it is very obvious that the COVID vaccines are safe and they are very effective, and there is really no harm in getting the vaccination, as these do not cause problems during the pregnancy. Next one, please. And this was already alluded to, just to look at some of the data. I am in private practice in Cuyahoga County, and we are seeing a lot of COVID now. We did see a lot of COVID back in 2020, the beginning of 2021. What is different now is that there is a lot of shortage of healthcare workers in the hospitals and even in the pharmacies and vaccination sites. National Guard has been called in. I practice at Hillcrest Hospital. We have 60 people from National Guard. We have 20 Air Force clinical personnel that landed in Cleveland Clinic yesterday. Still, there is a lot of shortage, and that makes it even more riskier for people to get hospitalized. So that when they are in the hospital, they may face more problems in terms of secondary infections and higher risk of complications. The risk of COVID during the pregnancy, pregnant women are 15 times more likely to die of COVID compared to a non-pregnant woman. And that is not very well publicized. They are 14 times more likely to get intubated. We have a 24 to 36 bed ICU, and there was a question of how many pregnant women we are seeing. In one of the hospitals where I go to, out of the 400 beds, we have had up to 220 beds filled with COVID patients, out of which about 18 to 20 are pregnant women. So it's about 10% of the hospitalizations that we are seeing that are pregnant women, and about 1% of the people that are hospitalized, depending on their severity, end up in the intensive care unit. And also, the pregnant women are 22 times more likely to have a preterm birth compared to vaccinated individuals. Next one, please. And this gives more information regarding what are the different types of preterm births and what is the risk of that happening during the pregnancy. Next one, please. And the risk factors during pregnancy are there is increased risk of COVID complications for women that are older than 25. And if you look at our general population, there's a lot of women that are over 25 that get pregnant. So many of the pregnant women automatically come under this higher risk category. Those with in areas where there is high number of COVID cases, obviously Cuyahoga County, Hamilton, we are seeing a lot of COVID, so that again puts them at a high risk. And as already been referred to, women in racial and ethnic minority groups, they are also at higher risk of complications from the COVID. Next one, please. And this led to the American College of OB-Gyn recommending vaccination, which was a major step in us addressing the vaccine hesitancy. When this recommendation came out, this really helped the providers to recommend and stand behind that. And the next one, please. So this is just a quick outline of the Cleveland Clinic experience. To see these numbers, I think this is really eye-opening. 75% of the hospitalizations are among unvaccinated individuals. 87% of the ICU admissions unvaccinated. 91% of the COVID ventilated patients are unvaccinated. And almost all deaths are among unvaccinated. So each and every death from the COVID, we feel strongly that this would have been prevented, and this makes us even more determined to bring the right education and the right message to the unvaccinated individuals to help them to get vaccinated. So I'm going to stop there, and thanks again for the opportunity.
That study is amazing, and the statistics are equally as amazing and concerning. So, Dr. Goje, you're next.
By introduction, my name is Tosin Goje, and I'm an obstetrician gynecologist and also an infectious disease specialist. So the past almost 2 years has been an experience because we've learned on the job. Sometimes I go back to look at my notes of what we wrote in March and what we're saying today. And it's been an experience. So in the next 5 to 8 minutes, I'm going to quickly just give us an overview, and then we can go to the questions. So I'm not sure of how many people, the mix of the audience, so we can always come back to questions. It's important to understand that the SARS-CoV-2 causes severe respiratory illness. Yes, some people have just a little cough and itch, but it causes severe respiratory illness, and that's why it gets its name SARS-CoV-2 and other cardiac, hematologic, and neurologic complications. So why are pregnant women at very high risk? Pregnant women are more susceptible to microbial infections in general. Now, in pregnancy, there's downregulation of pro-inflammatory cascade that alters the physiologic milieu. So pregnant patients are vulnerable just because of the physiology of pregnancy, and that is why they're at a very high risk for COVID infection, as Dr. Mukunda alluded to. The first data that came out was in June of 2020 that showed that the hospitalized symptomatic pregnant patient with COVID was 5.4 times more likely to be in the hospital, to be in the ICU, and even to be ventilated. And of course, this data was disproportionately towards the underrepresented minority. This data is the same as it was in 2022 as it is today. This study is from last week, Thursday. This is a population study of all pregnant patients in Scotland. This is a population study of all patients in Scotland, looking at patients who got infected with SARS-CoV-2 and then looking at the data based on being vaccinated or not being vaccinated in Scotland. And just for color coding, the blue is the unvaccinated, the green is the partially vaccinated, and the yellow is the fully vaccinated. This just tells the story. More than 95% of pregnant women in the hospital, in the ICU, were unvaccinated. This is the story from 2020, and this is the story right now. And it cuts across race or demographics because it has to do with the physiology of pregnancy. In addition to pregnant patients being admitted, being in the ICU, being ventilated, there is emerging data now about stillbirths in these women. The most recent data shows that looking at adjusted risk for stillbirth, comparing patients that had COVID-19 and those that did not have COVID-19, COVID-19 documented at delivery was associated with increased risk for stillbirth in patients that are not vaccinated, with a strong association during the period of Delta variant predominance. At the beginning, we were looking at the placenta, and there were cases and case reports of stillbirth in mothers that had COVID-19. Now there is a population data. This is from CDC. This is the MMWR of November 26th of 2021. And this is population data from March 2020 to September 2021. So this is a lot of data. The adjusted risk for stillbirth was high. So this is another reason why we have to talk to our patients about getting vaccinated against COVID-19. Now, COVID-19 vaccine has been shown to be beneficial. The initial hesitancy was that the clinical trials did not include pregnant women. A lot of monitoring has gone on in pregnancy. My first set of pregnant patients that got the vaccine received it in December 2020. Hundreds of thousands of pregnant patients have received the COVID vaccine. And looking at 8 different monitoring sites from December 15 to July 2021, they were able to look at COVID-19 vaccine during pregnancy, and the 2 variables they looked at was preterm birth and small for gestational age. I agree that this population data have their limitations. And number 2, most of the vaccination happened in the 2nd and 3rd trimester, but still, COVID-19 vaccination during pregnancy was not associated with preterm birth or small for gestational age at birth. Conversely, COVID infection, as Dr. Mukunda had shown us, is associated with preterm birth and poor obstetric outcome. So CDC and all the Women's Society recommend vaccination for women who are pregnant, recently pregnant, lactating, who are trying to get pregnant, or might even become pregnant in the future, because the data is getting stronger as the number is getting larger for statistics. COVID-19 vaccines are strongly recommended for pregnant and lactating individuals. They do not increase risk of infertility. They do not increase risk of 1st or 2nd trimester miscarriage, stillbirth, or congenital anomalies. One of the things that causes hesitancy is how do vaccines work? And I'm so happy that I was able to listen to the presentation from Dr. Kami about moms-to-be. Education of the underrepresented minority is key, whether it's one-on-one or as a group, because how vaccines work is very important. This is my own little spiel. I read and I try to create for my patients in a way they understand. The mRNA vaccine is not a live vaccine. It teaches, I use that word. So I was happy to hear about moms-to-be. It teaches our cells to make a harmless piece of a spike protein, which is found on the surface of the Rona. They need to understand how it works. After making the protein, it now shows up on our cell surface, and it's my immune system that recognizes it. And my immune system builds up antibodies. And if you see the next stage of it, this is what is seen both in the vaccine and in the natural immunity. Your body sees the spike protein, whether it's a vaccine or natural immunity. The difference is with a vaccine, you know when you got it, how much you're making, when you're protected. With the infection, you don't know how much immunity you're building. So they need to understand, and that way, a lot of this misinformation is debunked, because vaccine hesitation has to do with myth, facts, rumors, misinformation, and evidence-based information, as we are talking about today. There was an article I wrote. Most people are not anti-vaxxers. They just get either rumors, misinformation, or myth. And at the end, they don't know what to do. So this is the same thing. It's always important to explain to people how vaccine works. When a pregnant patient tells me, give me the vaccine, I'm okay, I trust you, I say, no, let's talk about how it works. Because as Dr. Kami said, when she understands it, she gets it, and she's able to talk to somebody else, and somebody else talks to someone in the community or in the church, and that is how we get vaccinated as a community, instead of just one person getting vaccinated. Another room for hesitancy is the side effects. Oh, it's going to make me very sick. It's going to make me this. The side effects during the research and the real life side effects are still the same. Pain at injection site, fatigue, chills, muscle pain, which is the same thing you get when you get a flu vaccine or a Tdap, or if you go to a party and you dance too much, it's always the same thing. Yes, we have the blood clot issue with the Johnson & Johnson, but in 2022, we have a lot of options for vaccines. It does not affect fertility in men or women. There are multiple studies, we don't have time to look at it today, that have looked at the semen parameters in IVF clinics in men that got the mRNA vaccine and found no difference before and after the vaccine. We already have looked at some studies. It doesn't cause miscarriage, low birth weight, preterm birth, or poor obstetric history. Patients will ask me, when is the best time to get the vaccine? And I say now, because we need to protect you, the mother, first, before we protect the baby. And the reason they ask is because of the study about transfer of immunity through the placenta and breast milk. There have been studies, yes, most of them are small sample size, but we know that antibodies from vaccine are actually transferred transplacental, and vaccine-generated antibodies have also been seen in breast milk and in umbilical cord. So not only are you protecting yourself, you transfer some of the antibodies to your babies. How long the antibodies protect the baby, we're still waiting for the research. How much protection the baby gets, we're still waiting for the research. But the fact that you can protect a baby who has immature immune system, I think is a benefit that everybody would like to get. This is another study that was looking at mothers who got the mRNA vaccine, looking at maternal serum, neonatal cord blood, and looking at dried blood and breast milk. You can compare the both and see that the cord and neonatal blood levels were higher in infants of vaccinated mothers than in those of women that recovered from COVID-19. And the reason is you generate antibodies based on how much infection you have. So not everybody is going to generate the same amount of antibodies, and not everybody has a good immune system to actually mount a robust antibody. So pregnant and lactating women elicited good humoral immune response. Vaccine-generated antibodies were present in umbilical cord blood and breast milk after maternal vaccination. COVID-19 vaccination confers a robust humoral response in pregnant and lactating women, and there's immune transfer to the neonate via breast milk and the placenta. This is a recent study, Edelman et al. Oh, it's going to cause my menstrual cycles to be long, to be this. Any stressful condition can make anyone's menstrual cycle different. This study just came out this year, 2022. There was a difference of 1 day, and hopefully there'll be more studies. It's important for our communities that we keep talking about this, we keep sharing. I believe in transparency because, as I said, vaccine hesitancy has to do with rumors, it has to do with myths, misinformations, and we need to debunk all. I'll stop here. Thank you very much.
As we take control of the screen again, thank you so much, Dr. Mukunda and Dr. Goje, for those presentations. You went over quite a bit that I was going to ask you, but I will ask, because I want a definitive statement all in the same section together. Will the newborn, if someone gets vaccinated, have antibodies and therefore immunity to the virus if a mom who's pregnant gets vaccinated?
Yes.
What, if anything, should a nursing mom be concerned about with the vaccine?
There is no concern. She should know that it's beneficial overall. The benefit outweighs the risk.
And if someone is trying to get pregnant, how does the timing of the vaccine make a difference? Are there adverse effects if receiving fertility treatments, as an example?
No. The timing of the vaccine does not matter. You should go ahead and get your vaccine at any point in the fertility treatment.
Good. Dr. Mukunda, anything to add to those questions?
Agree completely. I'm lucky to have Dr. Goje, who handles our patients when they refer to her and addresses the vaccine hesitancy. Agree completely.
We would love to access or share some of your PowerPoints because they did speak to a number of studies in California and Scotland that have direct connections to the outcomes for pregnant women. And I think, as you indicated, Dr. Goje, information is power and education is power. And so being able to get these kinds of studies and information into the hands of many of the folks who are on this phone as either clinicians or service providers in the human service space would be really, really important. The more information we get out to those people who are directly working with moms, the better off we are. I'm going to be opening this up to all panelists now, and I'll call upon you individually because I really would love, as you've heard all of the presentations, what is the one thing that you would like our pregnant and nursing moms to know about the effectiveness of the COVID-19 vaccine? And I'm going to start with Dr. Koch. What's the one thing you would like to convey to pregnant and nursing moms about the COVID-19 vaccine?
Hello, can you hear me?
We can.
Okay, great. And I think I already mentioned it, but I will say it again, that the risk to those pregnant or breastfeeding is from the disease itself, not from the vaccine. And my co-presenters have presented incredible data to support this. And so I think, you know, all of our efforts need to be focused on encouraging, having discussions, and helping these very vulnerable individuals get the factual information, answer their questions, and facilitate their getting vaccinated. Thank you.
Thank you, Dr. Koch. As we ask each of our panelists the same question, I would welcome our audience to type questions into the chat that we can then read and respond to. Ms. Jones, tell me what your belief system is in terms of the one thing that you would really like our pregnant and nursing moms to know about the effectiveness of the vaccine.
Thank you. I agree with Dr. Koch and the other co-presenters that, you know, we know the vaccine is safe and it's one of the number one things you can do for the health of not only you, but your unborn child. And then also thinking about the families that we surround ourselves with. You know, with COVID-19, we know that we're all in this together. And this is one of the things that you can do to protect yourself and those around you. So that'd be my one thing.
And we will move to Dr. Kami. What's the one thing you would like our pregnant and nursing moms to know about the effectiveness of the COVID-19 vaccine?
I guess just to echo everyone so far, that it is safe. It's encouraged at any point during pregnancy, before pregnancy, after pregnancy. And if you ever have questions about it, you can talk to your provider and you can really talk to them any concerns that you have.
Dr. Mukunda?
In the medical school, you know, we are taught that pregnancy is not a disease. Pregnancy is healthy and physiological. So during pregnancy, I tell my patients, I don't want to see you as a patient. I want you to remain healthy. And no one is safe until everyone is vaccinated. So please vaccinate yourself and vaccinate all your family members and spread the word to friends.
Thank you. Thank you. And Dr. Goje, your presentation was chock full of great information. What's the one thing that you would like our pregnant and nursing moms to know that hasn't been said already about the effectiveness of the COVID-19 vaccine?
I just echo everybody. It is safe. I think that is the main thing. It is safe.
Good. I see one question that was in the chat. It was put in the chat while Ms. Jones was speaking. And the question is, I think one slide showed that African American women were getting COVID at a much smaller rate. Is that just missing data?
Yeah, I can start. That could very well be the case. It could be a missing data issue. I think, unfortunately, I can't remember which panelist said this, but, we're kind of building the ship as we're flying it. I think we'll have a lot more robust data once everything kind of settles, once we're out of the pandemic. But right now, I think it could probably be an underreporting. Not sure if anybody else has any additional thoughts on that.
Anybody have any additional thoughts on that?
One more thing, maybe lack of testing too. That could be an issue as well.
Good call out. Thank you. So we are challenged because data takes time to collect and develop and study to make assumptions on. And so what would you say to a service provider as they are attempting to work with moms who don't have the education? It's one thing to say it's safe, and there's lots of studies to prove that. But are there other phrases, terminology, points that you might want to share with a service provider that allows them to talk in a very informed manner to folks who they're working with? Anybody can take that question.
I will take a stab at that. So the most important thing is the trust. When the things are addressed by a trusted provider, the discussion more often leads to vaccination compared to speaking with someone that's not a trusted provider. Motivational interviewing. So the important thing is to really elicit what is the hesitancy. One of my patients, when I was talking to him about vaccination, he told me, "Do you feel safe to go in a spaceship?" Now I understand, where the concerns are. You want to know what is the safety, whether someone that has done it and stayed well. You may not believe what you hear, but what you see is what it is. And when we tell the patients that this is what I'm seeing, this is really protecting people, that makes a big difference. I think for the trusted providers, the most important thing is to listen and listen patiently, elicit the concerns, and then address them, rather than just to say it is safe, take it. I don't think that works very well.
That is a very informed, great answer. So I heard, first you have to be a trusted provider. And so building that trust with the person that you're working with is important. You have to listen because the concerns are real, either based on bad information or good information. The concerns are real. Illustrate by giving examples and give information that people would be able to study, read, or be able to understand. Really great steps. Anything else? So there's another question in the chat. Has anyone seen an effective method to address women who may share they are not receiving the vaccine due to the direction from their religious leaders and or the religious beliefs? We have quite a bit of a diverse community here, and we have had many of our folks here that for religious reasons, people are uncomfortable or not willing. Is there anything that we can share with those folks that are having concerns with taking the vaccination because of religious beliefs or leaders?
Director, I know in collaboration with Columbus Public Health, Franklin County Public Health, we convened our faith leaders here locally in Franklin County. And we do, I believe, have some resources that we can share with the participants in the groups. I know it's my understanding that for the majority of religions, the larger religions, most of them have come out with a statement endorsing vaccination, not saying that it's anything that goes against their personal belief system. So we're happy to provide any of that information that might be of value as people are having that conversation. We recognize that. I think it goes back to what was said, those trusted messengers and the trust of their religious and their faith leadership is key and crucial as we continue to respond to this pandemic.
That would be very helpful, and because we have access to all of the folks who at least registered for this event, we can get that information out to those who are registered, and we can place the other information on our website for those who are watching on YouTube. So any of that information would be really well received and appreciated by CelebrateOne as we continue to do the community education that we're known for. There's another question. Go right ahead.
If I may add, that's a great point. That the All Plans had a round table, like a town hall in Toledo, where they invited many of the religious leaders and had the questions answered. And everyone spoke in unison that vaccines are recommended, and there is nothing religiously against it. It's very interesting that when we hear something like this, it actually is an opportunity to understand where the member may have heard that message, whether the message was wrong or whether the understanding was wrong, and correct it. And if the message is actually coming from a trusted provider or a leader, it gives an opportunity to directly communicate and understand what their concern is and what their hesitancy is, and address that, because that will help a lot more members to get the right message. We saw that actually in some of the obstetricians who were hesitant to advise vaccination to some of the members. And when the members called the health plans and they said, I was not told to get the vaccine from my provider, when the medical directors reached out to the providers and talked to them, and they connected them to the right specialists and consultants that they would trust, that made a big difference. So I think when we hear something like that, that's actually an opportunity to spread the education and to get more people involved.
Excellent, Dr. Mukunda, thank you. Actually, this question kind of builds right upon that last answer that you gave. The next question is, do any of our panelists have information about the most effective research-proven way to combat vaccine hesitancy? Is it education as we've had today, or are there other tactics we as practitioners should be taking to address these concerns?
So the most effective research, in my reading, has come from Kaiser Family Foundation, which does the periodic surveys to the community members and also to healthcare workers. So there's a lot of data addressing the vaccine hesitancy among healthcare workers, especially with women in the long-term care facilities, the nursing profession, who are hesitant to vaccination. And the number one effective way of addressing this, again, is through the trusted provider. As a medical director, CareSource, which employs a large number of women, I get many calls. I've been texted, emailed, asking questions, and almost always I tell them, this is what I have found, but please talk to your primary care provider. Dr. Dixon mentioned, Dr. Goje mentioned, you want the person to have that conversation with the provider that's with them for long-term, longitudinal care, that will stand with them, lead them through the side effects if there are any, and reassure them that this is a minor side effect which we can deal with, and this is not going to cause any long-term problem. So I think the trust and connecting them to the primary care physician really is what the research has shown so far, with motivational interviewing by the people that are addressing the hesitancy and also by the trusted provider.
Excellent. Anyone else want to chime in on that? There's a question, is there any chance we can get the slides from today's event? We will work with our presenters, and those that are comfortable, we will make them available, either on our website or through direct email to you, but we'll work with each individual presenter today to ensure they're okay with how and when they can be presented. So we will work on that for you. And then there are a couple other studies that I think that have been referenced that we might be able to send links to as well. Again, this is our goal today, was to ensure that we got as much information about what is correct to pregnant and parenting moms and those practitioners and social service providers that work with pregnant and parenting moms, to ensure that our families are as safe as they possibly can be in this 100-year pandemic. I'm going to call on each of you to just give some final thoughts as we wrap up today. Any last thing that you want to reiterate? Any last thing that you want to share? Any advice to practitioners that are on the line with us today to give them the tools and that they need in order to be that trusted advisor, and what information can be shared in a manner, in a way that may get better results for vaccination compliance. And so I'm going to start with Dr. Koch. Any final remarks?
So, first of all, please feel free to share my slides with the participants. And I'm hoping that the additional slides that we didn't have time to cover today will be helpful. They're taken from guidance from CDC and specifically address some of the vaccine myths or even myths about COVID-19. And it's the slides are meant to be how you could use with people in our community. So in clear language, and the wording is taken from the Your Health guidance at CDC about COVID-19. So I'm hoping that that would be helpful. And then also my contact email and phone number is provided at the end of the slide. So if there's any way that I can help, please always feel free to reach out to me. And again, thank you for allowing me to participate today.
Thank you. Thank you. Ms. Jones.
So I think relationships are key, and it was hit upon, with not only us as, trusted providers and having that relationship, but as I mentioned, we've done a lot of work to give our community-based organizations, and we call them ambassadors, to have those resources, to have those conversations, because, we know as this pandemic continues that governmental agencies are not the trusted source for information, right? So what kind of leverage can we use for those already trusted messengers, trusted partners in communities where people live, work, and play? So that's what I would encourage participants on this call to do, is to engage with their community partnerships, because it takes all of us to get through this. So.
Yep. Thank you. Thank you very much. Dr. Kami.
I would just say, just continue having those conversations. Take the minute or 3 minutes extra in your time in the office with the patients. I know it's hard for all of us. Our schedules are crazy. We're inundated with COVID everything, but that minute matters to that patient. So take that time with her. Additionally, just as a plug for moms to be, I saw a little comment in the chat. If you have a patient or somebody who's pregnant in Franklin County or Montgomery County and wants to get connected with our program, please refer them. You can send us an email at momstobe@osumc.edu, and Director Stapleton can also get you connected with me as well.
Absolutely. Absolutely. A major partner of ours, Moms to Be. So thank you, Dr. Kami. Dr. Mukunda?
I would like to say thank you to everyone that is participating in the call today. Thanks for everything that you are doing to make the community safe, to help our members, your patients. One other resource that's available, the managed care plans are contracted with the 2 vendors. One is called the Sterling Rapid Response, which is headed by Dr. Kofi Amoha, who is one of the scientists that was involved in the Pfizer research. And the other company is called OFFOR, O-F-F-O-R, which is an organization that employs off-duty EMT technicians They have mobile vans, and they are willing to go to anyone's house and do the vaccination at home. Sometimes the members don't feel comfortable going to a public place or go to an event, maybe due to their concern about getting sick or because of the hesitancy. They don't want others to see. Anything that prevents them from going out, if they want somebody to come to the house and do the vaccination, these organizations will help you. And I'm happy to share my slides and my contact information. I'm happy to answer any questions and be available to help. And as we discussed, no one is safe until everyone is safe. So thank you for all your help.
Thank you. Thank you very much. And finally, Dr. Goje, any final thoughts?
Thank you for inviting me, and I'm happy to share my slides to the participants. And I echo everyone, trust and education. I think educating our patients is very important. No one is an anti-vaxxer. They just need to understand the why.
Thank you. Thank you. I can't thank you enough, panelists and audience, for being with us today. Information is power, and we know that that is the only way that we will continue to fight this 100-year opportunity to educate our community. We will be following up with a survey. We also will be following up with additional information. The panelists have indicated that you can certainly reach out to them as needed, and we will follow up as well. For those of you who are watching on YouTube, you can always visit the CelebrateOne website for additional information. We have connections not only to all of these wonderful folks that have been talking and educating us with us today, but we also have a connection to a number of service providers for pregnant and parenting moms. And so if you know someone in need, or if you know someone who just needs a question answered, call us. We can get you in touch with not only some of these professionals, but others who are dedicated to maternal and child health in Franklin County and the city of Columbus. Again, thank you to our panelists. Thank you to the team at CelebrateOne that was able to put this together. And we look forward to continuing to educate our community on COVID-19, the vaccines, and the positive impacts that they can make on our communities. Thanks, everybody, and have a great rest of your day.